have better health equity and more sustainable healthcare systems, we need several things. First off, we need to have a significant health investment in every country in the world. Sometimes I hear people talk about healthcare costs being too high, but it's important for people to look at healthcare as an investment. And there's really not much beyond, basic food and shelter. Once you've provided that in a society, healthcare pretty much comes next. And investment in people's health is an investment in the country, is an investment in the future. In order to have increasingly improving healthcare systems, we need to make sure that we're funding innovation. In many countries, even the money spent on medicines is mostly not for innovative medicines. And so incentives that really reward innovative medicines and that over time the price for non-innovative medicines really goes down, that's really key, so that we continue to deliver breakthrough medicines and there's support for that innovative industry that is really providing the solutions for the future.
So maybe let's start with innovation, because I do think a lot of health inequity is because of people have diseases that make their lives less than optimal. So I think the most important way to increase health equity is to really innovate the innovation that's happening in the biopharmaceuticals industry, which is just revolutionary. It's just, we're in a revolutionary phase. The next 30 years is going to be about biology. If the last 30 years was about digital and technology, the next 30 years is about biology. I think that will create a lot of equity, meaning you'll be able to treat people's diseases that just really suffered from significant morbidity. That would be number one. Number two would be that that in terms of delivery of healthcare, there's some inequities around the world. And I'm going to take the United States, the country that I'm from, where it's a system that is more equal than it was 10 years ago, but there's still a lot of inequity about the delivery of care. I think what I'm most intrigued about is the fact that the healthcare delivery system around the world is now going to be much more digital. And that's being enabled by electronic medical records. They've only been in place now for 6 or 7 years. And the ability to have data will allow healthcare systems to change the incentives of care. Because now, like for instance, in the US, the whole system is based on volumes and on transactions. And I think if we can move to a system that's based on outcomes, and you can do that when you have data, then that will be a more equitable system.
I think from a regulatory perspective, there are barriers, vary country to country. And ultimately, I think that we need to lower the regulatory barriers and be able to make drugs kind of like we did during the pandemic, except all the time, right? Like why is it just during the pandemic that we get fast, highly effective drugs? Why can't we have fast, highly effective drugs all the time with this huge innovation wave that's going to cure so many diseases? So I kind of think we need to demand more of our regulators. So I think innovation in healthcare is actually going to save us all. And the innovation wave that's coming is really going to change the world, and it will change the world all the way in the poorest areas of Africa as well. And that's really if we can make things cheaply. So we do need to invest in ways of kind of democratizing the solutions by kind of doing what the semiconductor industry did and just make things more and more cheap, high impact, and then push them out to the rest of the world.